Family doctors are on guard right now for diabetes, which has reached epic proportions in the United States.
We seem to be picking up at least 1 or 2 diabetics a month. A lot of that is attributable to diet. A lot of it is attributable to obesity, which seems to be rampant here in this state. It also runs in families. As you know, diabetes is caused, we don't know the cause of diabetes, but in adults it's called type 2 diabetes, and it's due to the body not using the insulin that's produced efficiently. It's called insulin resistance. It's very important to control your diabetes because of the complications that go along with that disease, especially heart disease. Heart disease is what usually kills diabetics.
But many of the problems diabetes causes can be delayed or avoided with good medical care, support, and information.
If it's hereditary, it's hard to prevent. The main thing initially is diet, staying on a low carbohydrate diet, avoiding sugars, simple carbohydrates like sweets, sodas, that kind of thing, and staying on a high protein diet. The other aspect is exercise. With exercise, you burn off all the excess calories, and that will reduce your blood sugar. If you're diagnosed early and are managed well and keep your blood sugars down, then you can avoid the complications and the future risks that go along with it. That's the important thing.
While there is no cure for diabetes, there is hope.
There's several stages in the management. The diet is still primary in terms of management, but there are several other drugs that are used. There are drugs that stimulate the pancreas to make more insulin. They're called sulfonylureas. There are several in that category. There are several drugs which help your body use the insulin more efficiently, drugs like metformin and Januvia, Onglyza. So there's several drugs in that category. The hospital has a diabetic educator who's very good. She's very thorough. So we refer a lot of patients to her for dietary counseling, and also she can show the patients how to use their glucose meters to check their own sugars and give them an exercise program, that kind of thing.
The Medical Minute is brought to you in part by CHRISTUS St. Francis Cabrini Hospital.